All right, welcome everyone. My name is Emily Shift. I'm the Recovery to Work Business Advisor here with the Surry County Office of Substance Abuse and Recovery. I want to thank you all for taking the time to be here today and learn more about the Recovery to Work program. Together, we can fight the stigma associated with individuals who are in recovery seeking employment. Here in a few minutes, you will hear from community leaders on how Recovery to Work has impacted Surry County and their business. But first, I would like to take a moment to recognize our public officials here today. We have Mark Marion, our Surry County Commissioner. We have Chad Hutchins with the City of Mount Airy. And we also have Stephanie Blair. She's a representative with Tom Tillis' office. Thank you guys for all being here. Chris.
I'm Chris Knopf. I'm the county manager, and I have a esteemed honor today to introduce to you our new substance abuse recovery director. If you've been working with the department very long, you know that Mark Willis left us on Friday, and we sent him off in a great way last week. Had a lot of fun with him, but I'm excited about Jamie Edwards. Jamie has been with us for a few years now. He's been working in the community for a long time. I'm sure many of you have met him if you've been involved in mental health in this community, public health, social service issues. He is a well-known figure, and we are really excited that he's taken the department from this point on into the future. So at this time, I'll let Jamie Edwards come up and say a few words.
Thank you, Chris. Welcome, everybody. Yes, thank you for coming. Yes, Chris is correct. This is day 2.5. So that means Monday, Tuesday, and today, which is a pretty big ask. When Emily mentioned this idea in October, and she mentioned the first week of December, I somewhat questioned that, but we're all in the right place at the right time. This has been a combination of many efforts. This has actually been in process for almost 3 years today. And please take note of the small logo that we hope you will be seeing around the community more and more. This recovery-friendly workplace program. It's a program that we're really proud of, that Emily will be sharing more about with you as we move forward, and the panel will be talking about. What we do within the Substance Use Office is really a partnership of local government. And this office, the Office of Substance Abuse Recovery, is a unit of your local government. We work for you. Today is also a partnership with the Piedmont Triad Regional Council, specifically its Workforce Development Board. And we do have a Workforce Development Board member representative in the room, I believe, somewhere in the very, very back as a staff person. We were fortunate to receive significant funding from the Appalachian Regional Commission around 22 months ago to create a planning grant to look at some of the most pressing needs in this community, especially related to economic development, job training, employment, and retention. And because of this Appalachian Regional Commission planning grants, that allowed us to build on top of some of the prior work that had been completed the past 2 years. And that, again, was only possible because of our county government support and that of the Piedmont Triad. Last September, we published a not very well-known document yet that's available on our website. It's called the Surry County Strategic Plan for a Recovery-Oriented System of Care. That's a lot of terminology from my part of the world that I really will not get into. But if we peel that onion back all the way, how can we create a healthier environment in this community for all community members? And if we can do that, do we increase the economic vitality of the community at the same time? This product was 175 pages or so, and the focus was economic development and job training and supporting those individuals in recovery and individuals struggling to find their place in recovery. What do we mean by recovery? Individuals who may be suffering from substance use or behavioral health issues. and they're finding ways to improve their lives and that of their family members. This product, in the very end, if you go to the very end of the document, through a collection of local data, national research, and we contracted with a firm in the Midwest to make a national search of how Surrey County compares to other parts of the nation. This report culminated into 5 focus areas you see in front of you. Healthcare access, that's medical access for medical care, physical, your body, and also behavioral health and substance use. Employment supports, retention, employability skills. How do we sustain a positive workforce that can definitely impact you and your companies and sectors? Housing. Housing has been a significant focus of this office and the county for a significant period of time. Transportation needs. How do we enhance transportation networks for the community at large, but especially those involved in the recovery process? And educational pathways. How do we ensure those individuals entering the workforce who frequently have deficient skills, especially soft skills, so if you're spending your time walking that recovery journey, how do we help increase that capacity? That's my 3-minute spiel. I promised I would only take 5 minutes from Emily of the past 5 years. We're really proud of this work. We hope to have some printed copies available very soon. We also have cover sheets or 1-page summaries you will see beginning to float in our communities. We frequently have questions that's being asked of us. What is the priority for the next 5-10 years? So we can make a difference and improve the opportunities we provide the community at large, but especially those in the recovery space. These 5 items are the basics of our priorities. We believe if we can do a good job with these 5 items, we are certainly building a community that can support the journey of recovery and support the community at large. So thank you so much.
Okay, before we start, I would like for the panelists to give a brief description of themselves. Please provide your name, company, and your role, starting with Chris.
Chris Knopf, Surrey County Manager.
Jenny.
I'm Jenny Drone, HR Generalist at Applied Polymerics.
Lenny Slitch, General Manager of the Hampton Inn in Mount Airy.
Sonia Cheek, Intervention Team Coordinator with the Office of Substance Abuse and Recovery.
Thank you all. So in 2018, the Surrey County Office of Substance Abuse and Recovery was started. So Chris, can you explain why the Surrey County office was created and why did the Board of Commissioners decide to create the office?
Actually, the person who sort of came up with the idea this was very much needed in Surrey County was our health director, Samantha Ames. I don't know how many of you have ever had the opportunity to work with Sam, but she's been with the county a very long time. She worked her way up through the health department to the role of director well over a decade ago. But it was actually a meeting in May of 2017. She came to the Board of Commissioners, and she had what I've always referred to as the manifesto. It was a very detailed, well thought out plan and a basis for some sort of substance abuse recovery program, actually a position, one position that needed to be created in county government to start to tackle this problem. As probably many of you may recall, there were times when on a quarterly basis, Surrey County was #1 in the state, and sometimes referred to as #1 in the country in the number of emergency room visits per capita for substance abuse related issues. That's not a very good statistic. And so a lot of attention was being focused on what was going on in our county, even though it was a problem nationwide, but why was it so much worse here? And I think that was May of 17. Within 2 months, she was able to convince the board, myself, Sandy Snow, our assistant manager, that we needed to do something. So we created, at the time, called the Opioid Response Director, and that was July of 2017, but it was actually May of 2018 before someone actually filled that position, and that was Mark Willis. And he was a one-man show for quite some time. I'll never forget his first day on the job. He he walked into the office, or I think I walked into his office actually, and he said, well, what am I supposed to do? And I told him, I have no idea. There's no one like him in North Carolina. It was sort of very innovative, what we were doing at the time. The master settlement funds that all of you hear about that the counties all across this country are receiving over the next 2 decades, that wasn't even something we were talking about or thinking about. So we were funding this on our own. And I gave him her manifesto, and I said, this is where you need to start. And from there, he built the department that you see today. We went from the opioid response department to the more broader, I think, titled Substance Abuse Recovery Department. But a lot of the credit, if not all the credit, on how we started belongs to Samantha Ainge. And you don't hear her name associated much with what's going on here, but she started this, and what she came up with was very innovative, and she deserves a lot of credit for us and the board having confidence in starting this program.
Thank you, Chris. So currently, I have over 50 companies that are supporters of the Recovery to Work program. And I go out to companies and just talk to them about our program. So one of my companies is Hampton Inn. So Lanice, what was your first thought of the Recovery to Work program when I come out and talk to you? And why did you choose to become a supporter of the program?
Well, my first thought was, this is a great idea. This is a great idea that you're pitching to me, because it was a time, you have to understand, where I was having a very hard time finding employees to do the work that I needed to be done at the Hampton Inn, because it is a physical job. And as you guys know, around this time when this started, a lot of people, they just weren't interested in doing physical jobs. So I was like, oh, this is a great idea. You know, I know how it is where I've seen people that have made bad choices in life, and it's so hard for them to get back on track because nobody gives them a chance to prove themselves and to show that they are really ready and responsible enough to carry on a position at a company. So I thought to myself, you know, when people are gainfully employed, they have a sense of structure, they have a sense of community, they just have a sense of purpose. So I thought, okay, God gives me a chance every day to try to get it right. So why not give somebody a chance if they're really trying to work on their recovery and be good people of the community and citizens? So I thought, you know, this sounds like a great opportunity. I don't have to pay anybody to find me employees. I don't have to spend the day trying to find employees. So why not give it a try? What could it hurt? And so that's what made me decide to join and be supportive of the program.
Thank you. Jenny with Applied Polymetrics.
Well, when Emily approached me about this, I honestly thought, are we a good fit for people in this situation? We're out-of-town workers. We're road and bridge repair, so it's construction, manual labor, and I thought, is out-of-town going to be a good fit for people that are going through what these guys are going through? And, you know, talked to Emily about it a little bit and felt pretty comfortable with it, and she sent someone to be interviewed. And he's honestly been one of the best people that we've added. He's so just hardworking. He's grateful to be there. He just boosts the morale of everyone around him. Like, we've all been in a situation where somebody has just not wanted to be there, not wanted to be at work, and it just ruins the whole team. And I think just having him there and wanting to be there, he's done great. He's been there 8 months. If we get people past the first year, they typically stay for years on end, but it's like the first year, people aren't used to physical labor. They're not used to being out of town. So he's been there 8 months, and we only have 2 other people that are under within 6 and 8 months. So, I mean, if that tells you anything there. But I thought it was great. I feel like it's not as risky as some people might would think, because anybody could wind up in that situation if they've had a surgery or anything like that. I mean, I feel like we all have the same opportunity to make a bad mistake. So I don't feel like we should hold their past over their head and just let their present self speak for them.
Sonia, I know you have had some experiences in the past with having lived in experiences and looking for work after coming out of recovery. Can you kind of share your experiences and maybe the challenge you had with looking for work?
So I am in recovery. Emily kind of wanted me to give a little backstory, so I'll do that. I am one of those people. I will celebrate 5 years sober in January, and can finally say I can finally say I'm in long-term recovery at that point. I worked for Baptist Hospital for 13 years. I thought that was my career, and I had 13 years, that's a pretty long time. So when I basically got fired because I overdosed on the job, right? So getting sober, I now have a criminal history. I have now been locked up. I now have no vehicle, no house, no nothing. So getting out of jail, most folks don't have their ID, they don't have their social, they don't have anything, barely the clothes on their back. Safe housing, you gotta live somewhere, or you're going right back to the same dope house you came from. And for me personally, my first job out of jail and being sober, I had some pending charges, so people were afraid to take a chance on me. So my uncle owns a paving business and said, look, I'll give you a shot one time. You show up once late, you're gone. And I worked that job for 1.5 years, almost 2 years. He gave me a chance. In early recovery, we're used to not keeping our word and doing what we say we're going to do. It gave me a chance to create some accountability for myself and start life over, because basically that's what it is. I had no checking accounts. What ones I did have were overdrawn. Getting a bank account just to get that first paycheck. Transportation to get to work. I walked to work. So there's several challenges, but that's just a few of them.
Thank you. Lanice, is there anything that you would like to touch on?
For the most part, the experience has been positive for me. Anytime you hire anybody, any employee, there are risks that you're taking each and every day. So whether they're in recovery or not, you're taking a risk. And I have actually found out that people in recovery, they have a sense of purpose. So they have, and in response to that, of me giving them a chance, they're willing to do anything that the business may need. They're willing to work those extra hours. They're willing to come in on their days off. They're willing to take on extra projects because they are more, I feel, loyal to you as far as getting the job done and being thankful that you gave them a chance, because so many people did not give them a chance. So for me, yes, we've had some people that did not work out, that did relapse, because that is a risk you're taking, that somebody may relapse. But it did not make me feel like I didn't want to participate in the program because of that one person, because the 2 other people, I currently have 5 people employed that are going through the program, but the other 3-4 people that I have are doing such a great job that one did not affect the way I felt about the program. And again, you have to understand that I am working in a business where it is very physical. And people just don't want to do those kind of jobs anymore. My front desk staff have been there for years, but then my housekeeping, high turnover, maintenance, high turnover, laundry, high turnover. And for those positions, I don't really have to, I don't have to advertise for them anymore. I can call Emily up and say, hey, do you have anyone that may want to do laundry? And she's like, yeah, I got someone I think that's ready. And that's another thing. She vets the person. She doesn't just send me somebody that says they want to work. She sends me somebody that she feels like is ready to go to work. So that makes a difference too. So I had that one employee that relapsed, and then I had the one employee that the judge decided, okay, you need to go spend 3 days in jail versus come to work. But as soon as that employee got out of jail, she called me up like, I heard I'm not on the schedule today. I was scheduled. I want to come to work. I just got out of jail, but my mom has my uniform and I'm ready to come to work. And so what did I do? Come on, come on to work, So, and she was coming through the program. So that to me made me feel good, that she wanted to be there. She was still dedicated to be there, even though odds were against her within the court system. So I just feel like people in recovery, they have a purpose. They have a sense of purpose, and they want to do better if someone will just give them a chance to do better.
Chris, would you like to touch on how the Recovery to Work program has impacted Surry County in any way?
I think about our own experience. As I mentioned earlier, we hired Mark. He was a one-man show. and the department grew. Jamie came on board. There was an outreach position that was added part-time initially, but as we got into the program, there was a point in time where, especially bringing in peer support positions, you have to have people with lived experience. You can't put someone like me in that position and expect them to resonate with people in recovery, because that does not work. So, like most places, you go through the HR process. There are background checks and things of that nature. So, in the past, Sonia, we've talked about this. We probably wouldn't have hired her. She wouldn't have gotten through the screening process. So, we had to do some soul searching in county government. We had to change our thinking. And so before this program was launched, we were already doing this. I think we have as many people in recovery working in your department as those that are not. And I'll tell you a funny story. Well, it's funny to me. I was in their offices. They're in the same building, so I spend a lot of time around these folks. We're in the same building every day. And one of the employees, we were just talking, and she said to me, I forget how we got on the subject, but she said, if you printed out my rap sheet, it would be over 100 pages long. And that just really struck me very oddly. And I remember probably stood there for 2 minutes and didn't say anything. But that's what these people, when they're coming out, or when they're in recovery and they're trying to get on their feet, you have to have some grace. You have to really think about changing your perspective. And they're right. The program, I think, has a really high percentage of success right now compared to what I expected. And some of these folks, it may take 2 or 3 times before they actually get on their feet and into a routine that's positive and healthy. I also look at it from an economic development standpoint. We have a lot of open positions in the county, like most jurisdictions. I'm talking about local businesses. If there's 3,000 people between 18 and 64, which is the working ages, and they're addicted to some substance, if we can get a healthy percentage of those folks back in the workforce, that helps everybody. They're paying taxes, they're productive, they're helping local business and industry. So, to me, it is about people's public health, but it's also about economic development. We've got a workforce here, it's just a lot of them are struggling. And if we can get them back into productive society, that's a win for all of us.
Myself and a peer will go out and meet with the clients whenever they reach out to us. So there is a 3-page assessment on you that we will ask them their skills, what they've done in the past, where they have worked at before. So we do match the person with what they have done in the past. We just don't go out and, if they've worked at construction, and put them at, let's say, Wayne Farms. We want to set them up for success, and I do ask them a lot, what would you enjoy doing? What would you like to do? So I want to see them be successful. So there is a 3-page assessment form that we do fill out with the clients. And what are some other things that I know the peers have an assessment form that you guys ask as well?
It doesn't matter where these folks come from. They could come from rehab, or straight from the detention center, or, straight from detox. So it's not, there's no single source as to where they come from. Everybody's recovery story is different. I just happened to get sober in the same bed I overdosed in. So some people get sober in treatment. Some people get sober in jail. So it just varies.
Everyone is not ready all the time. And individuals have different levels of readiness. The journey of recovery is long. There's no magic bullets, no simple solutions. Statistically, if we can help individuals reach that long-term recovery status, that 5 years Sonia spoke of, in terms of that citizen being a productive member of society, being a wonderful parent, paying taxes, being that long-term employee, those rates of positive social engagement is actually higher than someone not in recovery because of those challenges and experiences. Also, addiction is a disease of the mind, body, and spirit, and community. And if addiction is a disease of the mind, body, spirit, and community, addiction drives isolation. The more isolated someone is, the deeper you go. So one of those things that workforce development and employment opportunities can do is help us break the isolation. It helps us build social networks. We all have professional networks that we would not be sitting here today without those professional networks. Individuals in recovery tend not to have those networks, or if they did, they've been broken over the years. So repairing some of those networks are a great predictor of the future, not only for individuals, but the community at large. I go back to the ROSC, Recovery-Oriented System of Care. All that means is building networks that leverages the talents of this community and the opportunities that exist in this community where we don't leave anyone behind, or at least provide that opportunity. And your employers, economic development leaders, educators are as important to that as anyone else, maybe more important in many ways. And we frequently don't talk about that.
So I have a question for the three ladies at the end. What are some of the challenges that you see with some of the clients in the Recovery to Work program?
Transportation. That is the biggest, transportation. We need some form of public transportation or some form of transportation for the folks that are in the program, because the 5 that I have, thankfully, half of them do have reliable transportation, but then the others are constantly, daily, looking for rides to work, looking for a ride home, and things of that nature. So transportation is a huge issue for what I'm dealing with.
Same, Judy.
Transportation, absolutely.
So what kind of questions do you have for our panelists?
I'm wondering a couple of things. Is peer support mandatory for the people in the program? And is it confidential to other team members that they're working with side by side?
Yeah, we started out when we only had Wayne Farms on board. They actually give me badge access to their facility. However, I'm not a fan of just going and pulling somebody out so they know they work with us. It is not required, but if they need us, we're absolutely there.
So, Lenise and Kenny, this question is more so geared for the two of y'all. What would you say to other companies who might want to learn more or get interested in partnering with the program? Or maybe if they're hesitant to get on board, what would you tell them?
I would say if you're willing to take a leap out on faith and be a little flexible, that there are definitely benefits to hiring someone in recovery. And that you should definitely speak with Emily about all the benefits or the pros and cons, because she definitely was able to address any questions that I had. There is also a benefit, a bonded benefit, that I was very intrigued by, where up to a certain dollar amount, the person that is in the program is bonded. So if you're worried about theft or something of that nature, Emily will take care of that. So that's what I would say to a business that's hesitant, that you may have a person working for you that's on the borderline of becoming an addict, or is an addict, just has not started that road to recovery. You may already have that employee and they may just be good at covering it up. They may be a working addict. So this program, at least I know I have a little bit of a background, and I know that they are working towards being a better person and being a healthier person for the community.
Yes, Tiffany.
Can you further explain that first question? What is the side-by-side access, and what is the, I can't remember the other verbiage he used in this question.
Confidentiality and peer support.
The peer support, what is all of that?
So peer support is somebody, I'm a peer support. We have 4 on our team, including myself, who have that lived experience, whether it be in substance use or mental health. Meaning we have that lived experience and we've been where they're at. And to have somebody walk that path with you makes things different. He was also asking about confidentiality and with the people we work with.
Yeah, so I guess, are you saying that you go on site and you're?
That is totally up to them. We can, but it is, most of the time we don't.
Okay.
Normally, we're just there to support the person who's being employed, whether, you know, they may call and have a horrible day at work and not want to go back tomorrow, or, you know, and you walk that process with them. So Wayne Farms originally started out and give me access to their facility where I could go in and meet with folks. I wasn't a huge fan of going in and just pulling folks out because it does kind of call them out and kind of breaks that confidentiality. But we don't do that.
Okay, so that was a one-off.
Yeah.
Okay.
It's been a learning process.
But Sonia has also called me before and asked, is an employee working that day, and is it okay to recognize them for working 90 days, or is it okay, you know, that she come by and check on them? And so I would call the employee and say, hey, Sonia would like to come by and speak with you, is that okay? And the employee would tell me yes or no. Most of the time they want to be recognized for their successes, so they're like, sure, yeah, she can come by. And they'll come by and they'll you know, just congratulate them for making it 90 days or a year or however length of term it is. And the employee is really, that makes them feel good too, that they have accomplished that. So
what responsibilities do the employers that are hiring through the program have to the program? Are there evaluations or reviews or accountability for the employees that the hiring companies are responsible for back to the program?
The employee is, they're totally your employee, yes.
I will say that anytime I've had an employee that I've had an issue with in the program, I can make a phone call to Emily and say, hey, we're having this problem or this issue with this employee. Is there something that you think you guys can do to help me get through this? And they'll say, absolutely, we'll set up a meeting with them. And they have set up meetings and it turned the employee around. So
sometimes they just need us to come talk to them.
just come talk, just show that somebody does care and wants them to be successful and not trying to just let them go for something that may be correctable.
As addicts, we're used to running. So if we do something that may not, could be wrong or in any type of way, we're used to running. And we encourage, especially if something happens where they get in trouble or something like that, to stick it out and to, play that tape all the way through versus running like we're used to.
That we understand part of success is supporting the employer through this process. But part of this 3-year Appalachian Regional Commission grant funding we've received, which is a significant pot of funding at the federal level that the local Workforce Development Board is matching dollar for dollar, is so we can develop methods and processes and mechanisms to support the employer as well. Support the employer and those staff who are willing to give this program a chance. But addiction is a pretty scary thing to talk about. It's uncomfortable to work with individuals in the throes of addiction sometimes, or even working through their recovery process. What's really normal for me is somewhat abnormal for others, especially when you're speaking of formal organizational processes in for-profit business, that this could be seen as a liability or a risk. So therefore, we have this sense of responsibility, along with the Workforce Development Board and our recovery-friendly North Carolina partners, that's statewide, within the 13 states of the ARC as well. These programs are being funded through 13 states via the ARC to try to answer some of these really hard questions. Those questions that you may be thinking of yourselves, that you may be driving down the road that pop in your head? Or that, all this sounds really good, but really? We want to try to develop some conversation, and that's part of the process. And one of the reasons of today is to begin developing these conversations.
And chime in as well. The concern about negligent hiring, I think, can come up sometimes with hiring people who an employer knows their background, takes a chance on hiring them. And for instance, Jenny, I'm guessing some of your folks might be driving. So if they're driving and they drive impaired and cause some type of harm to themselves or others, what is the risk then of it becoming a negligent hiring issue?
I'll have to defer that question to the human resource folks and business folks, although I can say it, and we know, Kit, this is popping up in the literature and some of the best practices in New Jersey and Nevada and North Carolina, Tennessee, that tends to be leaders in this space. And those are common questions being asked.
I will say that I try to work on a person's strengths and not their weaknesses. So if I know what their background is, then I'm going to try not to put them in certain situations.
Yeah.
And then also, I'm upfront with them when they come in, because again, I am a hotel and you never know what's going on in the room. So I let them know ahead of time, this is what may be in the rooms, this may be what you're presented with. Are you strong enough to handle this situation? And then I'll just kind of monitor them for the first 30 days to make sure that we're on the same page. And again, the experiences that I've had thus far have been good. I haven't had any issues. So I would say that I follow regular protocol, and I just try to work on what I know or feel like their strengths are, and try to keep them away from things that I know are a part of their history.
I have tried to field certain situations and put them with supervisors that I think can help them grow and keep them focused on their goals. We have several people that did not come through this program that have similar backgrounds. It's construction. We have policy on what's acceptable to be hired and what's not, but it's pretty lenient because it is construction. What I try to do is I'll talk to Emily, or Emily will talk to me, and we have great communication as far as, like, do you think this person is, like, able to handle this downtime in a hotel, or able to handle, not having to come home to a wife or something like that, and can handle this free time out of town. And so I feel the person with her first, and then I try to put them with a very structured, very observant supervisor that and I don't tell them their background. They're usually up front with it. Like, they'll go out to the crew and they'll get comfortable with the supervisor and kind of tell them, this is kind of what I've battled with in life. And I think, you can correct me, but I think that's a part of their recovery as well, is like acknowledging that, this is where I've come from, but this is where I'm trying to go. So we haven't run into any more issues with hiring through this program as we have hiring with outside the program.
Yes, I can say that is pretty much it too. When the employee comes in, they're honest with their teammates about what they've been through and where they're trying to go, and so that helps a lot, because a team member will come and say, hey, I think this, or I think that, she told me this, or he told me that, and then that helps me to be more aware of what may be going on. So I still follow the same policies and procedures that I would with any employee. It's just I know more about this employee because they're going through this program, which could be a good thing.
Right. Yeah. And real quickly to follow up, talking about transportation, has I always think, wouldn't faith-based organizations be a great partnership? But I don't know if that's pie in the sky thinking, or that.
Before we created the transportation program as part of this department, we attempted that.
Really?
Yeah, and it just wasn't going to work. I think there was interest, definitely, from the faith-based organizations, but finding the volunteers, having a regular schedule, it was just a challenge for everybody, and it just didn't work out that way. The faith-based community has been involved in other positive ways, though, but that was our initial hope.
Yeah.
It just didn't work out that way.
Expound on that a little bit.
Of course.
Yeah, when we first started having meetings, the first meetings were with the faith-based community. We called all churches, all preachers, trying to get them to come to a meeting to decide what we wanted to do, how we could all come together. Every church in Surrey County was contacted. So, decided what we was going to do. Everybody's thing was transportation. So we was going to make sure these folks got to their treatments, their appointments, make sure they had follow-ups. So when it comes down to doing it, all the questions started popping up. Where are we going to have to go to get these folks? Are we going to have to go to the drug house to get these folks? So one by one, they started pulling back. And so about 3 meetings in, we decided we're going to have to go a different route. So it just kept ringing. And next thing you knew, the last one was, 15, 20 people that showed up. And everybody became afraid of what might happen. So.
I will say the first 3 years of the transportation program was actually funded with a U.S. Department of Justice grant. And if there's any need I think all the resources in the department are needed, but that one is taxed more than probably any of them at this point. So how we address that, I don't know. But even with that being said, when it came time for this department to find drivers, they found them. And a lot of those folks have an experience themselves that I guess, drew them into this type of work. So,
how many miles?
We've driven around the earth now in a span of 4 years, 3.5 years. That transportation has generally been reserved for medical appointments, recovery-oriented treatment, pharmacy trips, and so forth. We have dipped our toes into providing transportation to work, and it was a pilot process that suddenly became overwhelming. And
So they cut me off.
yes.
Real quick.
Yes.
They cut me off really quick.
That was a call of panic from that particular respective coordinator for transportation. But those concerns about transportation that this panel has seen, that you may have seen and observed anecdotally in your community, is also what the data says as well. There's consistencies. There's consistencies in all these conversations. These issues do not exist in isolation. They exist as part of our community. And without that community approach and conversation like this, we will fail to make progress. It takes the community at large.
2 years ago, the nonprofit agencies held group conversations about the needs that we had. And we thought that we would come out with housing being our number one issue, and it was not. It was transportation. But the preventative side of that is, if we don't find a way to grow a public transportation program, we ourselves are guilty of causing some of these situations. Because if you have a young adult who has issues to begin with, that is in a bad neighborhood, that cannot get a ride to work and cannot go to work, they are seen as weak prey from dealers, and they are approached for a way to make a living to not go to work. That hurts the entire community. So it starts what we're trying to stop. It's not only them, we have seniors that do not have transportation and do not have individuals to take them places. So it is a problem that we've had that has continuing to grow. So unfortunately, some of the things that we lack are causing these beasts that we're trying to take down.
Absolutely. Katrina, I know you had a question.
Well, I was just curious, outside of transportation, if money were not an object, are there other aspects or areas of the program that you've identified that you would like to either expand on or needs, any additional things that might be
I just have some basic needs that I'm just working with the community college currently. It is just the basic skills. When someone that I start working with, they just need the basic resume, interview skills, how to dress for an interview. Those are just the basic skills I need that my clients need. So I'm working with the community college. That's something that we're partnering with starting in January, just the basic skills. So I'm hoping to get that started.
A lot of what I'm encountering, not just through this program, but people don't know how to fill out onboarding paperwork like W-4s and I-9s and things like that, or to list a beneficiary, like they have no one to list as a beneficiary for something, or things like that. Like they don't understand, like they don't either know what beneficiary means, but like filling out the onboarding packet once they're hired, I feel like is a intimidating thing for several people, because they either don't have anyone to list for beneficiaries, or they simply don't know how to fill out the form. So like I think if you're doing resume and interview skills, maybe this is a W-4, this is how to correctly fill it out type of situation would help them be more confident coming to the interview.
And that beneficiary thing, definitely, because I've had some ask me, can I put you down as my beneficiary? And I'm like, no. But they're like, but I literally don't have anyone to put down. I don't have anyone I can trust. I don't, family ties are not good. So that really hit home when she said that.
I run into a lot of hiring men, and the mother of their children won't tell them their kids' social security numbers to list as a beneficiary. So then they don't want to come back because they're embarrassed of that, or they can't complete that paper, so they hold all the paperwork because instead it's like a constant, and they go out of town, so it's like a constant, I need that paper, and then they don't want to say, well, the mother of my child's not going to tell me that information for me to list it. You know what I mean? And it's just, and they don't want to say that either.
So they need to know the common, knowledge, or be educated that if you're the father, you can go and get this on your own. The mother doesn't have, but they don't even have that basic knowledge or education to know that they can do those things.
Yeah, so it's a big struggle that I face.
It's just the basic skills that I struggle with. Bank account, like Sonia hit on. We just need to open up a bank account.
Well, and the problem that I've run into with that is there's overdrafts in so many different bank accounts, they can't create a bank account because no bank is going to bank with them. Or if they still had that account open and I direct deposit them, it's going to get ate up with so.
You mentioned Sonia, and you're talking about the peer support specialist. Some people might have a misconception of what they do. They don't only just work with the workforce program. It's Sonia, tell them what you're doing. You mentioned.
So we've kind of combined all of.
You recovered where you got.
Yeah. So we, like I said, we have a team of 4 of us, and we also connect folks to treatment. So I have absolutely had like Wayne Farms reach out with a current employee who went to them struggling and wanted and needed help. We've met with those. We take people to detox, to treatment. We have drove as far as to Wilmington in a day and back to take somebody to treatment. So, we work in both local hospitals as peer support. We have badges. We're non-paid employees at both local hospitals. And we just connect folks to treatment if treatment is the route they want to go for their recovery.
You left out the main part.
Oh gosh, what?
Who do you work with a lot?
Oh, the same man who arrested me. Yes, he actually, they actually helped me move on one of their days off into my home. So we work hand in hand with the guys who we once feared and once had us in handcuffs.
Can you speak a little bit in here about training? Is that the kind of training that you have available? Is the how to fill out an application, do a resume, those kinds of things?
Yes.
So if Jenny came to you needing any kind of somebody with skills with welding, let's say, is there anything in place to help facilitate that kind of thing?
So that's where I would partner with the college. with Corey Easter with the customized training program. And currently I try to, when I first meet with a client, I always ask them, can we direct you towards the college? Because I definitely want to get them some kind of skill or trade before getting them to work. And then the only thing that's on their mind is, I gotta work. And so I think I have, Rhett, how many? 8? I think I've sent Rhett 8 referrals to the college.
Something like that.
And I have 4 that are actually taking classes over there currently that's enrolled in a program or getting a skill or trade currently. So I do try to get them placed. And then when I do have someone, I will reach out to Jenny.
You help them with financial assistance for those?
That we do not have the funds for that, but that's something that the college works with the client with. But I do direct them to the college.
So some of these items are in developmental stages as well. If you notice, even the logo, Emily's logo, we were relatively methodical and thoughtful. Recovery-friendly workplace program. Some of these programs in other locations were simply called Recovery to Work. And if you think about recovery-friendly workplace program, think about that being an umbrella with multiple people, places, and things under that umbrella. The first being supporting the employee, increasing job skills, training opportunities, improving workplace readiness to actually walk in the door, but also improving retention. Retention is the issue. I've worked in the criminal justice system for a long time over the years and with at-risk populations. Placing individuals in employment is not that hard, especially in this community. Retention beyond 6 weeks is extremely difficult because some of those social threads and support mechanisms have not been in place. So that's one part of the umbrella, that's under the umbrella. The second piece, the primary second piece is helping those educational institutions, secondary schools, employers, understand some of those challenges that comes forward, that Kit spoke of or the panelists have spoke of, that come with this. It naturally comes with the population. As with all employers and employees, you have different sets of challenges and expectations of different types based on employing someone like me as opposed to someone else, right? So it's creating a flexible system that ensures the individual that we refer is ready to go to work. They may be ready to go to work, but are they really ready? They may need to go to work, but is their mind, body, and spirit ready? Their body may not be ready. They may not. We have recovery facilities in other communities that have policies. That's actually standard, very standard. For those facilities, those long-term care facilities say, if you're receiving housing from us, you do not go to work for 4 weeks, sometimes 6 weeks on purpose, because it takes someone that long to even begin clearing your head. So if we place that individual in a job, in a training opportunity, 4 days after a certain event, or 4 days after the event, I think we do more harm than good. We do more harm than good to the individual, to the citizen, and also to our partners. So it's a balance. It's evaluating risk and need to make sure that we do the right thing for the right person, for all the stakeholders. Otherwise, we have some pretty serious unintentional consequences, especially with our business partners, or especially to the Appalachian Regional Commission, that we assured them that we would create 3 new in-demand occupations that's a good fit for this population that they're willing to pay for. 3. So we have to be very methodical with the typical opportunities that's a good fit for this population. That's also a good fit for the employment sector as well. It's just not one piece. And we can provide support to those 3. Those 3 have not even been identified yet. As Katrina asked, what do we need help with? What a perfect group to ask in terms of in-demand occupations that should be created and supported with a local community college and with local providers. What are those in-demand occupations? That's a good fit. That is a question that we must figure out collectively in coming months. One of those other priorities is to provide training opportunities, technical assistance to not only, well, to folks such as yourself. We surveyed the workforce 14, 16 months ago. We did a regional survey of Surry County West to Asheville. We collected 112, I believe, survey results, which was pretty good. We surveyed employers. Of those results that were collected between here and Asheville that we led, that actually some of the regional western part of the state efforts is being built on. 60% of the population that filled out that survey were nonprofits and government agencies. 40% were commercial companies. But consistently, irregardless of the audience who filled out the survey, there was a common theme. We really want to help. We really want to be part of this. We don't know how, and we're really scared to try. Teach us. That is one of the reasons we exist. To help the community learn how to do this, if you're so interested. And not only with the recovery to work issues, but also community issues in general. This is a hard personal conversation. I would be willing to bet that each of us have someone in our families involved in this issue, one way or another. Therefore, it's a personal issue. This probably met challenges with the faith-based community. It was so personal. It becomes so personal, it's scary. And it's hard to make sense of. It's hard to figure out what to do, how to do it the right way. And so when you see the little gears, it's about all the above. Those 3 in-demand occupations, I'll throw that back to Katrina, who's a master at this. What is those 3 in-demand occupations? I know, because we kind of knew each other in the very beginning, and what are those 3? We can work on 3 the next 3 years.
Thank you, Jamie. Does anyone?
My question is for Chris, Jamie, and Emily. If somebody was to take what you've done, is there a blueprint to transfer that to another county that's in need outside of transportation? If we've got employers that are interested, if we've got resources, and we've got a population that needs to be served, how do we actually get started?
So I think some of these things are transferable. I think you'll have to tweak them. What that looks like, I don't know, for each respective county. But I do know since we've started this department, we've been inundated over the last 4 or 5 years with requests and inquiries from counties all over the country. And I kidded Mark Willis when he left. I said, that's what you need to do. You need to make some money, and you need to tour the country and tell the story about the program that he assisted in building with these fine people here today. But I know that with some of the planning documents and things that we have online, I know other jurisdictions have taken those and sort of utilized them to some extent in building their own programs, their own plans. So I think, yeah, it is transferable.
I just want to address the financial situation question that was asked about retraining. That's where your Works Career Centers can come into play and assist with retraining. Brett, I'm sure you're familiar with that. That can offer financial assistance, and there is an adult and a youth component to that as well. It is criteria based, but that is a connection that could be a possibility for these individuals to have their training paid for and so forth.
And replicated in other communities, because you exist in other communities.
Yes, NC Works is the state brand for workforce development, and they are in the majority of each county in North Carolina.
That's actually good Lisa mentioned that, because we're their Invisible Appalachian Regional Commission grant. We did something brave that we're really not sure we're being brave, and included 16, 17, and 18-year-olds. And we really never did that with anything we've tried. To be very, very specific with those out-of-school youth who are at significant risk for negative health outcomes, and involvement with substance use. And because we can't do that ourselves, we have to leverage Lisa's office, workforce development, other community nonprofits, and it's our attempt to go upstream, as I call it, and is in public health, to help those in need, especially those youth, who are maybe making some at-risk choices, but not as at risk as they could be later on? And can we provide an opportunity of training, education, and employment for those youth that changes the course for them and their families? And if we can do that with youth, with 16, 17, and 18-year-olds, prevention is the answer. We will never have enough capacity or money to address things on the back end. It's too late. The problem is so large. But we can decrease the numbers on the front end. And employment and training is part of that process. These 5 items, part of the process to reduce the numbers in the front end so we can keep the numbers manageable as someone grows older.
I really want to thank the panelists for giving some insight on the program, and thank you all for attending today. Thanks.